Namaste. Let us discuss on vital signs. So, what is vital signs? Vital signs are a group of the 4 to 6 most crucial medical signs that indicate the status of a body's vital functions. These measurements are taken to help assess the general physical health of a person, give clues to possible diseases, and show progresses towards recovery. So these 4 to 6 vitals will give a clue whether patient is improving or not. So what are all the normal vital signs for the adult? So in a vital signs we could see temperature, heart rate, respiratory rate, blood pressure and oxygen saturation. So for a temperature, if you take a oral temperature for an adult, the normal temperature should be 97.8 degree Fahrenheit to 99 degree Fahrenheit, and the normal heart rate is 60 to 99 beats per minute, and respiratory rate normal is 12 to 16 breaths per minute, and blood pressure less than 120 mm of Hg systolic and less than 80 mm of Hg diastolic, and oxygen saturation for 95 to 100% is a normal oxygen saturation. So this is regarding normal vital signs for an adult. And next we will see age basis what will be the normal vital signs. If it is 0 to 1, in the sense neonates, the respiratory rate normal is 26 to 65 and heart rate will be 93 to 182 and BP high 80 by 52, low 45 by 33 mm of Hg. If it is a 1 to 3 months old, respiratory rate should be 28 to 55, heart rate 120 to 178 per minute and BP high 85 to 55, low 65 to 35 mm of Hg. And 3 to 6 month old baby, the respiratory rate should be 22 to 52, heart rate 107 to 197 and BP high BP 90 by 65, low 70 by 35 mm of Hg. And 6 to 12 month old baby, the respiratory rate should be 22 to 52, heart rate 108 to 178 per minute and BP high BP 100 by 65, low BP 80 by 40. And 1 to 2 years old, respiratory rate should be 20 to 50, heart rate 90 to 152, BP high 100 by 70, low 80 by 40. And 2 to 3 years old, respiratory rate should be 20 to 40, heart rate 90 to 152 per minute and BP high 110 by 80, low 80 by 40 mm of Hg. And for 3 to 5 year old, respiration rate should be 20 to 30 per minute, heart rate 74 to 138 per minute, BP high 115 by 80 or low 80 by 40. 5 to 7 year old, respiratory rate 20 to 26 per minute, heart rate 65 to 138 per minute, BP high 115 by 80, low 80 by 40. 8 to 10 year old, respiration rate should be 14 to 26 per minute, heart rate 62 to 130 per minute, BP high 125 by 85, low 85 by 45 mm of Hg. 11 to 13 year old, respiration rate should be 14 to 22 per minute, heart rate 62 to 130 per minute, BP high 135 by 85, low 95 by 45. 14 to 18 year old, respiratory rate should be 12 to 22 per minute, heart rate 62 to 120 per minute, BP high 145 by 90, low 100 by 90 mm of Hg. For an adult, respiratory rate should be 12 to 20, heart rate 60 to 100, BP high 140 by 90, low 118 by 60 mm of Hg. And the normal temperature for the age basis like infant to children less than 5-year-old, the temperature if we check it in a rectum, it should be 97.9 degree Fahrenheit to 100.4 degree Fahrenheit. And if we record in a oral, 95.9 degree Fahrenheit to 99.5 degree Fahrenheit. And if we check in a axillary, it should be like 97.8 degree Fahrenheit to 99.5 degree Fahrenheit. And if we check it in a ear, the normal temperature should be 96.4 degree Fahrenheit to 100.4 degree Fahrenheit. So, if the children above 5-year-old, the normal temperature 98.6 degree Fahrenheit. And the oxygen saturation for everybody, the goal should be 95%, 95 to 100%.